Thank you so much, Matilda. And thank you very much for having me today. Excited to be here. There's only one name on this first slide, but as Matilda mentioned, I'm doing this in conjunction with Paul Lansbergis, who is a great mentor in this area, and Dr. Carrie Redlick at Yale is also a mentor on this project. So I will jump in. I have probably too many slides, which I tend to do. So I'm going to whip through the first few of them fairly quickly, and then we'll get to the others in a slower fashion. So work stress is just one of these things that we see in the media all the time, and it's poorly defined. I think it can be very confusing when you see these reports. So I just want to clarify that this is, when we talk about work stress in the academic context, largely we're focused on these three major concepts. These are three models that have, certainly job strain has been around for decades, effort-reward imbalance has been around for decades, and organizational justice is a little bit more recent. But these are all validated measures of work stress, and they all have been independently associated with cardiovascular disease, which is why I want to highlight them. And that's really my interest, is in the cardiovascular disease outcomes that are related to work stress. So in terms of these, I just want to highlight that in terms of how the work stress has an effect is probably through several mediating factors, which you can see in this slide: high cholesterol, hypertension, increased BMI, probably sedentary, more sedentary behaviors, other maladaptive behaviors. So this is not necessarily directly causing cardiovascular disease, but is part of the causal chain. So in terms of the research that's been done in this area in the past, I've just taken a lot of these relative risks and hazard ratios from other studies, the largest ones being done by IPD work in the European context. And I just want to highlight that the relative risk, however you want to define work stress, it's not enormous. It's less than 2 in most of these studies. But it is significant in that it's pretty consistently related to coronary heart disease, stroke. And so the interesting thing about work stress is really that if it is causative, it is associated with very high levels of population attributable risk fractions of cardiovascular disease, because it is so prevalent in the community. So in terms of prevalence, there are various different estimates, but maybe it's around 38% or maybe 50%. It depends on the studies that are done and how you measure it. But it's essentially, you're trying to measure constructs, multiple different constructs that overlap. It may be less, it could be as little as 15%, but in any case, when you calculate it out, it is a major cardiovascular risk factor that is on the similar order of magnitude of other major cardiovascular risk factors like obesity, for example. And so those are calculations from meta-analyses. There was a large study out this past year that made a lot of headlines, that was just looking at one measure of something associated with work stress, which is long work hours. And in that study, it was a WHO ILO estimates. And the 2016 estimates were about 3.7% of all coronary heart disease and 7% of stroke mortality could be attributed to work stress. In terms of what that means on a global scale, that would be about 1.3% of all deaths if you look at the Global Burden of Disease study from 2016, and so it puts it at very high numbers. So you're looking at something like HIV being 1.53% of global deaths and long working hours being 1.3%. So just very, very high levels that could be attributed. Again, the causal pathways are less concrete, but it is a significant contributor to cardiovascular disease when looked at in that way. So in terms of where it's coming from, this past year, the American Psychiatric Association they do studies, periodic surveys, and when they ask what is the cause of work stress, it's these very concrete things. So the highest is low salary, long hours, lack of opportunity, heavy workload, lack of participation in decision-making, problems with supervisor. These are all items that are structural. They're not really due to individual behavior. It's due to the structure and the organization of work. So when we think about how can we prevent stress, work stress, and potentially lower cardiovascular disease risk, we can think of prevention in the typical ways of primary and secondary prevention. So secondary prevention would be something like an employee assistance program, which are very common and widespread. Primary prevention would be something like work hour rules in California, the ratio of nurses to patients, or or we can also look at this in terms of the prevention level at the individual and the organizational level. So at the individual level, some of these techniques in terms of prevention might be relaxation techniques, stress management. We see that a lot. But then there's the organizational level, which is work redesign, which is what we're really interested in here. So in terms of that, there have been, and Paul Landsbergis, who's on this study, has done a lot of this research in the past with systematic reviews of what has been done in terms of experiments. Randomized controlled trials have been done. Typically, they're fairly small and low quality with short follow-up periods. So like a mean of 9 months, which may not get at some of the more substantive changes in the organization of work, for example. So some of these reviews have concluded that the need for further research on natural experiments, for example. So in terms of natural experiments or other interventions at the organizational level, you can look at various different levels. What we're looking at here are new systems of work organization and worker ownership specifically. Okay, so just one of many possible interventions. Let's see. Okay, so I have to define worker co-ops. So this is really what we're looking at in this research. So in terms of the definition, we're really restricting the definition to workers who own the business and workers, these are all ands, and workers who control the governance. So there's some sort of democratically elected board, and workers who typically manage the operations of the organization. The goals of these worker cooperatives are generally to create and maintain sustainable jobs and improve quality of the workplace, especially for low-income workers. So it's also helpful just to identify what worker cooperatives are not. So we are not talking about just self-organized teams. So there's a lot of research on this, but the self-organizing teams often don't have full control over whether that team will continue indefinitely. So Volvo, the Kalmar plant was one of these highly successful 20-year period of self-organizing teams, but then was just shut down when Volvo was downsizing, for example. It wasn't part of the organizational structure. These are also not employee-sponsored ownership plans, which are also something that get a lot of press. And they're different from other cooperative enterprises, which also are much more common, where the workers don't necessarily have a say in the management structure or the work. Oh, I'm seeing I'm very far behind. So in terms of this, I'm going to just skip some slides. So worker cooperatives have been shown in a recent study that came out this past year in terms of comparison between the worker cooperative and the prior workplace to have much higher levels of job security and job satisfaction than traditional workplaces. And so in 2015, there was a natural experiment launched by de Blasio in New York, where he funded the development of worker cooperatives to the tune of about $4 million a year. And so we're exploring that through mixed methods research. So a quantitative survey, a survey instrument that will be analyzed quantitatively, and that's still in progress. And so in terms of that, I won't show the slides on the analysis, but we have a new data set that we're working with of all the cooperatives. And from this data set, it's a secondary data set. In general, it's higher percentage of women, higher percentage of low-income individuals, and higher percentage of especially Latinx population. In terms of the qualitative methods, we're ongoing with interviews, and I'm just going to skip here to just read you a couple quotes here because I don't have time. So this is one theme that was pulled out from the interviews. A lot of it has to do with being able to contribute in like meaningful ways, like having decision-making power. And I'll just highlight a little lower down because, you know, we could say we want good benefits for our workers and reasonable work hours and a good work-life balance, and we can make those things happen. Though as in a traditional workplace, it's not always that easy to make those things happen. Another theme that we pulled out was collective benefits. I'll just read this quote. This is about someone who chose to leave, that it wasn't working out in the co-op. And I just want to pull out some of this quote. But also the co-op is sustaining us, ourselves, plus a bunch of other people. So if the co-op is healthy, then the individual ideally will be healthy, like financially and like mentally and like having time off and like all of these things. I think ultimately we have to balance what's good with the co-op and what's good for us. We can't necessarily be making decisions that are going to benefit any one individual over the co-op. Because again, it's like if the co-op doesn't do well, then none of us do well. So some of these themes that we're pulling out are I'm just trying to highlight that the co-ops are coming at work from a slightly different perspective. And this is the last quote I'll give because I know I have to end. This is about equitable work and how they decided to pay their employees. And so actually one thing that we've done is we have a thriving pay scale based off a thriving pay scale calculator. And we basically have different salaries based on our identities. So it's like one of us is an immigrant or a person of color, they're going to be making more money than say a white person that comes from an upper class background. So we're like prioritizing people. We're basically prioritizing people that historically have not been valued. So we're kind of always talking about power and privilege. We pitched it to the group and everyone was really into it. And there's an extensive survey that happens. And yeah, it's in effect right now. It's pretty great. Right now, there's no pushback. Historically, I think there would have been, but there's not now. We're very transparent about it with new people coming in. Like, this is how we do it. It's not exactly, clearly not reparations, right? But it's like kind of a step towards that in a way. So I'll just end there. It's just the research on these individuals that are working in co-ops, I think, are coming at work from a very different perspective. It's a very small group of people, but does provide a natural experiment in which to evaluate the sources of work stress, as well as different formulations of work stress that they may experience in these organizations, and ultimately tell us something about possibly preventing work stress. And that's the goal. It's ongoing, and I'll close there because I'm out of time.